on behalf of OP Jindal Global University, and particularly on behalf of Jindal School of Government and Public Policy, a very warm welcome to all of you. I'm Upasana Mahanta, and it is my absolute privilege to moderate this expert panel on COVID-19 pandemic and its global consequences. The panel discussion will be focusing on health, education, food, and nutrition security. And we are very fortunate to have with us today three distinguished experts and practitioners from Jindal School of Government and Public Policy. Let me take a moment here to introduce our three distinguished panelists for this evening, at least for India it is evening. We have with us Dr. Vivek Padvetnaya. He is an associate professor and associate dean with Jindal School of Government and Public Policy. Dr. Vivek is a trained medical doctor with a master's in health policy planning and financing from LSE and LHTM, and a doctorate in public health, political economy from the University of Oxford. In addition, he holds a diploma in business management from ICFAI University. Vivek teaches courses related to health policy, health economics, health financing, and health services management. Our next distinguished panelist for the evening is Dr. Indranil Mukhopadhyay. He is an associate professor with Jindal School of Government and Public Policy. And he has a PhD in public health and health economics, an MPhil in public health, a master's in economics, all from Jawaharlal Nehru University, JNU in New Delhi. Indranil teaches public health, health economics, comparative health systems, development economics, political economy, and global health. And last, but certainly not the least, our third distinguished panelist for the evening, Dr. Sunaina Dhingra. She is an assistant professor with Jindal School of Government and Public Policy. Sunaina has a PhD from Delhi School of Economics, University of Delhi. Her research interests are in development economics, health economics, education, and public policy. So thank you so much to all the distinguished panelists for joining us here this evening. And thank you to all of you who have joined from all over the world to be a part of this conversation. Now, COVID-19 pandemic has brought to the fore a critical need for public health to be reimagined, to be reinforced, and to be enabled to ensure effective public health responses. So in this context, flagging off today's panel discussion, Dr. Vivek, if I may come to you and request you to start off the discussion by focusing on the broader aspects of global health security in context of the pandemic. Over to you, Vivek.
Thank you very much, Upasana, for setting the scene so well for us. I think as we move into the third year of the pandemic, it'll be good for us to take stock of the situation in terms of what are the various challenges that we have faced in addressing this pandemic, and how have we failed in addressing these challenges, and what lessons we have learned in terms of, what shall I say, combating the present pandemic, which is still going on, and perhaps, address the future pandemics that we may have. And if you look into it, we have faced a number of challenges, be it related to challenges related to global health security, or let's say ensuring universal access to healthcare, or how do we improve resilience of the health systems, when it is treated with a shock like this on one hand. On the other hand, these challenges could be related to, how do we address inequities in access to health technologies? Or let us say, how do we balance the health interest of a society on one hand versus, let us say, the economic, political, education, and other interests of the society when they seem to be conflicting with each other? So what is the way forward in such a situation? These are the various kinds of challenges that we have faced, and with no immediate or, let's say, perfect optimal answers to these challenges. I would like to look at in more detail the challenges related to the global health security that we have faced, and I would like to have my have my thoughts on what is this global health security, what are the kinds of challenges we have faced, and what's the lessons that we have learned, so that we are secure against the future pandemics that we may have. Suppose, let us say, if you say global health security, one way to understand it in the layman term is that no one is safe until everyone is safe. the WHO's motto for addressing the pandemic. So I think that in term encapsulate what do we mean by global health security. Now, if you have to have a global health security in terms of, let us say, protecting us from a pandemic, then we need to have a global health policy response. Now, we know that any policy response has to be based on a solid evidence, solid scientific evidence. So such a scientific evidence comes from having a global public health surveillance system. So if you have a global public health surveillance system which generates the kind of data that is required for us to have a global policy response to address a pandemic. Okay, fine. What is the kind of information or what's the kind of data this surveillance system can provide us? So it can provide us with a set of data which helps us to preempt the pandemic. That is a primary prevention, making the pandemic not happen. The second is that, okay, fine, the pandemic is in place. How do we contain the spread of the pandemic? What is called a secondary prevention. And then the third prevention or the tertiary prevention is that we need to have data on how do we mitigate, how do we contain the effects of the pandemic, be it on health, be it on economy, be it on education, or be it on other social sectors of the society. Now, with this understanding of what is global health security and how should the global health policy response should be backed by evidence, then if you look back at our present pandemic and the kind of challenges that we have faced in generating the evidence that is needed for a coordinated global health policy response, then we find that there are areas where we could learn a lot of lessons, because we find that we didn't have the kind of data that was required for a global coordinated response. As a result of this, many times we found that the global response to address the pandemic at best was fragmented. So what are these kinds of what shall I say, data-related challenges that we have faced? So to give you some of the examples, for example, let us say if we look into it, even though we had many pandemics in the past, we do not have a very well clearly articulated definition of what constitutes a pandemic to begin with, to collect the data. For example, if you look at the WHO 2010's articulation, it says the worldwide spread of a new disease. And then if you look at, let us say, the Dictionary of Epidemiology, a venerable source for topics of this kind, it says, and it defines pandemic as an epidemic occurring worldwide over a very wide area, crossing international boundaries, and usually affecting a large number of people. And finally, for example, let us say, if you look at the definition provided by the Center for Disease Control, Atlanta, it also says that pandemic is an epidemic that has spread over several countries or continents, usually affecting a large number of people. Now, if you look at these definitions, it gives us a fairly good understanding of what a pandemic is. But suppose, let us say, if you are a policymaker, let's say at a multilateral institution, these definitions doesn't give you a very clear operational guideline as to when to declare a health event as a pandemic. Okay, that's the first challenge that we have faced, and into the third year, I think we need to address this. And then the second aspect that we need to look into it is that, for example, let us say an adverse health event has occurred, maybe a pandemic. Now, to initiate or to trigger a global response to that, to address that health event, it has to be considered as what is known as public health emergency of international concern. It's a bit of a mouthful, please bear with me. Okay. Now, WHO is an organization vested with the responsibility of declaring a health event as a public health emergency of international concern. Okay, then the question is pandemic a public health emergency of international concern? That's a separate consideration. So what are the health events which can be considered as public health emergency of international concern? Even if you look at the parameters, which tells us, again, we see that the kind of questions that the expert committee deliberates is that, is public health impact event serious? That's the first question. The second question they face is that, is the event unusual or unexpected? The third is there a significant risk for international spread? And then, is there a significant risk for international travel and trade? Now, again, if you look at these questions are very broad, conceptual, abstract in nature, rather than giving specific guidelines for a coordinated policy response at the global level. So in such an instance, we call expert meetings. These experts deliberate over a long time, and we know that the essence in addressing a pandemic is an early response. And then suppose, let us say, if we declare pandemic as a public health emergency of international concern, then the institutions vested with the responsibility for global health should have a very comprehensive guideline, both at an international level as well as applicable to at the domestic level of individual member countries of the UN, in terms of what kind of measures they can initiate to preempt the pandemic, to contain its spreads, and to mitigate its consequences, so that the international response to this pandemic is uniform, coordinated, and cooperated. So we are all in this together to address this pandemic. And again, if you look into it, we don't have a very specific guideline in how do we address these pandemics. It can trace from, let us say, the early years of 2020 in terms of the kind of confusion that we had over wearing masks to the present confusion, should we give a booster dose or not? For example, WHO says booster dose is a scandal 2 months back. Biden's administration passed out a law saying that certain sections of the community need a booster dose, whereas Israel is preparing for the fourth shot, not even the third shot, fourth shot for its population. So again, you can see that there is a lot of lack of unison in terms of this. And finally, if we look into it, once, let us say, if we are able to declare a particular health event as a public health emergency of international concern, so how do we make sure that we have a very well articulated, precisely articulated guidelines in terms of how do we contain it on one hand, but on the other hand, more importantly is that how do we make sure that the member countries of the UN or the global countries adhere to these guidelines? In other words, I think there is an urgent need to strengthen our international health regulations, which was reframed in 2005, in ensuring compliance to these kinds of guidelines issued to contain public health emergency, which are of international concern. So I think these are the several concerns that we have in terms of, let us say, having a good public health surveillance system, which in turn can inform a global health policy response towards assuring global health security for us. I think I'll stop at this.
Thank you, Dr. Vivek, for that, and also for setting the tone for the conversation. And I think the takeaways, and that could tie up with what Dr. Indranil would come in and talk about in this panel. Vivek, from your talk is, you spoke about a resilient health systems. You talk about, addressing the issue of unequal access to healthcare. And you talked about the need for a uniform and coordinated international response. And you spoke about WHO motto, which is no one is safe until everyone is safe, which is interesting because, while some countries, and you spoke about Israel, is talking about taking a fourth dose, at this point of time, there are many other low-income countries where majority of the population haven't even got the first dose. And I think that sort of set the context for Dr. Indranil to come in, because he is going to talk about COVID-19, the vaccine inequalities in production, distribution, and also access to vaccine. So over to you, Dr. Indranil.
Thanks, Upasana, for such a brilliant introduction. And Vivek has very pertinently set the context so well for my conversation. And he talked about global cooperation. One of the very important takeaways from this pandemic has been what we can achieve through global cooperation. This is probably one of the first instances where a vaccine could be produced in such a short period of time. And how did that happen? If we look at the history of it, one of the key ingredients to do this is the technological know-how about the genetic sequence of the coronavirus. And thankfully, there were some scientists already doing their research on the coronavirus, existing coronaviruses. They could, once the pandemic unfolded, they could share that information, the genetic sequence, to the people. And that was one of the brilliant examples of cooperation, global solidarity. And many country governments, research institutes, vaccine manufacturers came together. There were so many partnerships that were forged to bring out multiple vaccines in such an unprecedented period of time. But at the same time, we saw some of the disturbing tendencies. Globally, there was a hue and cry that we should not use this pandemic and also COVID-related vaccines or other medical products. We should make them as public goods and not put them under intellectual property protections. You should not give monopoly rights to entities who are producing them. But we saw that some of these IP protections were retained. All the vaccines manufacturers, major global forces of vaccine manufacturers could retain their IP protections, monopoly rights over these vaccines. At the same time, we saw that the most developed countries, the richest countries of the world, using their power to negotiate higher prices with vaccine manufacturers, they could what we are calling today a phenomenon called vaccine grab, where they have much more, say, countries like US, Canada, UK, or much of EU, Israel, have many times more vaccines than they needed. For instance, I'll just give you a short example here. The excess vaccine that US has and UK has and Canada has, if we put it all together, excess, then say if you have covered all adult population with 2 doses and leave some for the most vulnerable people, the booster dose, the remaining is enough to vaccinate the entire of Africa. All adults of Africa. We only have 19%, a fifth of Africa adults getting fully vaccinated. Both intellectual property rights and lack of solidarity with Global South on the part of the big superpowers of the world, this inequity has unfolded. And we see the consequences in terms of the spread of Omicron as a result. But then one would argue here that see, this is a time where you have to protect your own country's interests before you can see the global solidarity. But there are examples in this world where developing countries are coming together, making this vaccine technology open source, giving other developing countries the technology to produce their vaccines. For instance, Cuba has produced numerous vaccines. They could vaccinate their entire population, but they could also hand over their vaccine technologies to many developing countries. Vietnam has done that. China is also doing that. So also there was this apprehension that, Global South will not be able to produce vaccines, but some of these countries have busted meet the needs of Global South. I think this is one of, and this kind of inequality that we see in the vaccine, access to vaccine is not new. There exist deep-rooted structural inequalities. We see some of these getting unfolded in this period of COVID. And this is the time where, say, for instance, the wealth and income of top 1% of the world has increased during this period of time, where global economy has shrunk at unprecedented fast rate, where unemployment has grown significantly. Now we see if you go by the latest World Inequality Report, we see that 38% of global wealth is with top 1% of the world population, the richest world of the world. So stark inequalities, and some of these inequalities are getting manifested in various forms. I think my colleague Sunaina will take some of this, but I'll close here just to say that the pandemic has unfolded or increased the structural inequalities that existed in the society, and it is time for us to think about these structural inequalities and take measures to address those inequalities. Thank you.
Thank you. Thank you, Indranil. First of all, for throwing light on the inequality to access to vaccines and how some of the countries have a better access of vaccines than the others, and what does it mean in terms of global cooperation, but also highlighting that some of the countries of the Global South have been able to produce vaccines effectively, and that says something about health systems across the globe. But also where you ended, I think, and Sunaina would love to pick up from there, which is talking about the deep-rooted structural inequalities that already existed in society that perhaps got a further boost due to the COVID-19 pandemic. And Sunaina, you were going to be talking about education and nutrition security. And even before the COVID-19 pandemic hit, hundreds of millions of people were already suffering from hunger and malnutrition. There was already unequal access to education. So what does the pandemic do to nutrition security, to access to education, particularly in the context of the structural inequalities that Indranil highlighted? Over to you, Sunaina.
Thanks, Upasana. Thank you so much. And absolutely, you've just said it right that these issues of nutrition security, malnutrition, hunger, poverty, and inequalities in education were there even before the COVID-19 pandemic came in. And I would just want to say that it's just made things worse and more problematic for the vulnerable sections. So yeah, if I would want to say, I would say that the COVID-19 pandemic has brought a shift in human existence. And one primary reason that has the community has faced the jitters of this infection is because we are truly global and connected in this 21st century. And reduced travel times, interconnected economies, sharing deep monetary overlap, and improved metrics of measuring social security indicators have resulted in enhanced effects of these shocks. And speaking of food security and nutrition, there is no indication that food is a vector of for the spread of COVID-19. However, the virus's spread and the efforts that have been taken to prevent it have a dramatic effect on food security. The uncertainty surrounding the nature of COVID-19 resulted in a number of countries implementing severe lockdown and physical distance rules. And these policies have a cascading effect on food systems, as well as on food security and nutrition of individuals, especially on the poorest and the more vulnerable population. And the effects are expected to last into 22 and maybe even longer. So it is not the availability of food grains that is of bigger concern. There is import. Luckily, we have had good harvest also in the last season, but it is primarily the pillar of access and utilization aspect of food security that is of a prime concern. Then the measures that were implemented caused a serious slowdown in economic activity and disrupted the supply chains and unleashing new dynamics and falling incomes. All of this directly and negatively affects the quality of dietary intakes. So for also example, like food transfers, like school lunches, all these programs, midday meals, for example, or other food programs, distribution of free meals, these were frozen and food markets broke down due to demand as well as supply constraints. And because of this, caloric intake reduced drastically, and the compromised nutrition threatened against the gains that have been already been done in poverty reduction and health. And all this may have lasting impacts on the cognitive development of young children, I would say. And at the same time, if you look at malnutrition, which includes both undernutrition as well as obesity, that has increased a person's vulnerability to COVID-19. So malnutrition may also rise because at this particular time, we are at a time where we already have the issues of obesity on one hand, and we have high undernutrition on the other hand, and especially in many developing countries. And the reason why malnutrition may further rise is because the healthcare system, which is already stretched, now more resources are being diverted from things like antenatal care, immunization, micronutrient supplementation. All of this that was the target before the pandemic is now most of the resources initially were diverted from that very need, the dying need to fight COVID-19. Now, it's not just in terms of nutrition, I would say it's also in terms of global hunger and food. I just mentioned that we don't have scarce food grains. But if we look at the inequality there, worldwide, an estimated 150 million people are likely to have experienced hunger in this since the pandemic. So according to the recent SDG report, almost 2.5 billion people are without food or unable to eat healthy food or a balanced diet on a regular basis. And if we talk about anthropometric indicators among children, among young children under 5 kids, the impact of COVID-19 is such that it has added over the normal levels, 22% more kids to the problem of stunting. So these are huge numbers, and stunting is a long-term indicator. These are all predictions, and what will eventually happen, only time will tell. These numbers were already large before COVID, and this pandemic has already taken 5 years of progress that was made in terms of improvement of nutritional outcomes. Coming to the consequences on education, I would say school closure during COVID have caused significant disruptions to education. It has reduced student learning drastically, and it has also restricted the activities of education authorities, parents, and decision makers. In a recent report by UNESCO, almost we are 2 years into the pandemic, third year has started, close to half of the world's students are still affected by partial or full closures. And close to 100 million more children haven't reached the minimum proficiency level of reading because of this health crisis. And because of the suddenness of the situation of COVID-19, teachers and administrators were not ready for the school to close. So they had to build an emergency remote learning systems almost right away. And one of the limitations of this remote learning system is that there is no personal interaction between the teacher and the student. So unfortunately, even though a lot of progress and emergency efforts were taken to support a remote learning experience, evidence that is now emerging, especially from developed countries, rich and high income countries. We are countries like Belgium, Netherlands, and the UK, which have a lot of technological power. Even in these countries, there are learning losses, real learning losses, and increased inequality. So there have been studies that shows that kids that are from better off families have gotten more help from parents during the closure, during the school break. So imagine what will be the case in middle and low income countries where there's already a lot less technology and a lot more poverty. These consequences are likely to be even worse. And not just that, not all children have had that opportunity or tools or access to that was needed to keep up the learning during the pandemic. And even still, for millions of students, I would say the disruption that was supposed to be temporary is like an abrupt end to it. And the problem doesn't just, I feel, end here. The classroom learning that used to happen, there are long-term challenges that we have in that would be coming only with time. It has been long been tested that test scores, the grades that student gets, they are linked to future employment. So if there's a decrease in your test scores, there's a decrease in employment. So an increase in students' achievement, on the other hand, lead to significant increase in future income. So, for example, if I remember, a study showed that an additional year of schooling leads to 8 to 9% increase in lifetime earnings of a student. So, in the absence of an intervention, imagine the learning losses that was caused by COVID-19 pandemic are likely to have long-term compounding negative effects on the future well-being of many children. And these learning losses may result in fewer opportunities for higher education, labor force participation, and lower future earnings. And not to mention that these consequences will be greatly varying by gender, with girls and women bearing the major brunt of it. So that is what I would like to that's why I want to conclude saying that there are much drastic negative effects that are yet to come, and there are some steps that we really need to take in terms of education and nutrition. The efforts that have been already in place definitely needs to be further strengthened to control or mitigate the negative consequences.
Thank you. Thank you, Sunaina. That was very, very illuminating, and you brought in a lot of interesting aspects to the conversation. Apart from the compound effect that you say that the COVID-19 pandemic will have in terms of access to education, in terms of learning within classrooms, or in terms of nutrition and malnutrition going forward, you also sort of brought into the conversation certain other aspects. You talked about, say, gender disproportionate impact, whether it comes to education or in terms of health and malnutrition. So there are a number of questions that are coming in, and I would want to ideally give some time to address those questions. But quickly, if I could come to each of the panelists and talk about, Indranil, you spoke about the structural inequalities that exist, that got further, pushed and sort of enhanced through and by the pandemic. We all agree that we need a better health system. We need a more resilient health system, that the health system must respond either to prevent or to respond effectively when the pandemic is in force. But what about the other kinds of structural inequalities that exist in society, whether in terms of gender or caste or class, that get further sort of played out in the context of the pandemic? If I speak in the context of India, we saw the migrant worker crisis that unfolded in the context of the pandemic. So the idea of class and labor force participation, Sunaina, that you spoke about, and how the pandemic impacted it. We saw a rise not only in the context of India, but across the globe in domestic violence. All of us have moved back into our homes to work, and the conversations about unpaid care work, the disproportionate burden that women bear in the context of unpaid care work within the families. Again, it is not a phenomenon unique to the pandemic, but that is a conversation that becomes more important in the context of the pandemic. The National Commission for Women in Delhi has record amount of distress calls that have come in, domestic violence in the context of the pandemic. So how does, India, that, and I'm talking in the context of India, all of you who have joined in for this conversation may think about how it applies. Some of you have written in the chat box about access to food and nutrition and education in context of your respective countries. So how does how does the structural inequalities play out in the context of the pandemic? And how does one respond as a society, as a community, as government, as public policy professionals? How does one respond to these kind of consequences of the pandemic? Briefly, I would like to come to each of the panelists, and then we open up for Q&A. Vivek, I'll come to you first. You have to unmute, Vivek.
Sorry for that. I think, thank you very much. I think it's a very pertinent perspective that one needs to look into as we look at the global challenges faced by the because of this pandemic. I think as I was talking earlier, in terms of when we have a guideline, both at an international level, at a global level, as well as at a given country level, in terms of what are the measures that we're going to take care in terms of containing this pandemic and mitigating the effects of this pandemic. I think one important factor that these guidelines have to factor in is we need to identify and map what are the vulnerable sections of the community, or what are the vulnerable sections of our citizens who are more prone to the effects of this pandemic, and give appropriate weight to them in our remedial measures. As it could be related to vaccines, as Indranil was saying, or it could be related to, let us say, food or education, as Sunaina was saying. Again, for that, I think I come back to my earlier point in terms of having a very good data intelligence system which can support which can give enough necessary support for the policy. I think that is an important aspect or an important ingredient of any nation's measure to address pandemics. How do we wait for vulnerable sections of the community, which could be women, it could be indigenous people, or it could be, let's say, people from rural area. I'll stop at this.
Thank you. Thank you, Vivek. Indranil.
Yeah, thank you. I think a lot of things are coming to my mind, but if we try to address how inequalities are getting unfolded, let's take the example of, say, gender-based inequalities, and particularly in developing countries. You mentioned how domestic work, the burden of care work, and also the burden of earning a living in a time where there is this lockdown kind of situation where basic subsistence is at stake. It always affects the more vulnerable sections of the society, and there is this intersectionality. So among women, it will also be women from the backward castes, or say poorer communities, or say if we bring in race, people. So, and they tend to manifest in this period of crisis. And so obviously we saw in Africa, in Latin America, in Asia, that women, in our context, the Dalits, the minorities, in other contexts, people of African origin, how women of these communities have been more affected. So now coming to the other point quickly on how do you respond to this crisis, and what are the so one, we need to take on these structural inequalities and their public systems, governments need to play a major role, but there is also a role of international cooperation. If you take the example, I'll just take this example of HIV/AIDS to illustrate my point. See, when the HIV/AIDS epidemic unfolded largely in Africa and other developing countries, we saw how intellectual property rights, IP barriers was becoming a deterrent to access to the medicines of HIV medicines, ART drugs. And now we saw over the next 10 years how developing countries came together, developed their own variants of ART drugs, brought the solidarities, brought together various countries together and broke the intellectual property barrier and could create the enabling environment to produce cheaper medicines. We need to bring, a closer, at least temporarily closer of the IP barriers and go for trips wherever at this period of time. That would be one of the ways. And also this is the time where probably the global reach, the richest 5% of the world has to think about a system of greater cooperation and solidarity. Public systems need to be strengthened. Yeah, I'll stop here. So many things too. And there are very interesting questions also.
Yes, there are. Thank you. Thank you for your comments. And there are very many interesting questions. So Sunaina, over to you, and then we open for Q&A.
Thanks, Upasana. Yes, indeed, they're very pertinent issues that you highlighted. And I would say that I would like to actually add on to the point about these consequences, about unintended consequences of this COVID-19. So we know that a lot of measures, mitigating measures have been taken to overcome as a result of this COVID-19. What are the problems of these COVID-19 or challenges that we faced? And that may also result in many unforeseen repercussions. And the problem is that those unforeseen repercussions may in fact have a greater impact than those that are anticipated. So for example, a number of countries have reported increased cases of domestic violence and alcohol consumption because of COVID-19. Stress, the breakup of social and protective networks, losing money, having less access to services can make it more likely that people will be violent or have hard time getting along with each other, right? And the facts that girls and women are disproportionately vulnerable in the areas of education, domestic abuse, child marriage, household workload, mental health has been there even before the pandemic. And it may just get even worse. So the strongest reason I believe that we need to study about these unintended repercussions or consequences is to inform the decision makers so that they just don't get into the problem of overcoming the unintended repercussions of the COVID-19 mitigation efforts. However, a bigger challenge that I see with that is that these unintended consequences or repercussions may not be immediate. For example, increase in intimate partner violence or child abuse have been raised, has already been flagged, but there may be other such repercussions. For example, increase in criminality that may only be observable months or years later because of the long-term economic consequences of the pandemic. So we need more longitudinal approaches to understand and identify some unexpected outcomes that may become apparent until a year later. So even for that matter, for education I mentioned, for nutrition I mentioned, it will take a lot of time for these unintended consequences to uncover. And we are still underestimating the true consequences of this COVID-19 pandemic.
Thank you, Sunaina. I think that's an amazing note to end the first part of the conversation with, which is that one doesn't only have to think about, and one must think about the immediate responses that the pandemic requires, but also to think in terms of the longitudinal responses that it will require, both in terms of health and access to health responses, but also in terms of the existing structural inequalities and what kind of consequences that the pandemic may throw up, in that context. With that, let me open up the conversation and take a questions. There are a number of questions. As a moderator, let me just put it out there that I may not be able to take up all the questions that are there. I will not be able to take up all the questions that are there. I have noted down some of the questions that we can address, but you all three of you as panelists can look at the Q&A section. So if you think I have missed an important question that you think you would want to take it up, please feel free to take that question up and respond. But the first question that I want to take up is that, we all spoke about the consequences of the pandemic. We all spoke about things that have not gone right. But there's a question here that can you also talk about the positive impacts of the pandemic, the fact that it has led to a technological revolution, that there is an increasing digitization. They say that every, challenge is also an opportunity. Indranil spoke about how, many countries of the South have, rose up to the occasion and got the vaccines out. And so would you like each one of you briefly talk about in your respective domain that you spoke about today, talk about few positive consequences that you see as a result of the pandemic. Vivek, I'll follow the same flow, so I'll come to you.
Yeah, I think one of the tremendous positive that we see from this pandemic is, as Indranil was saying, is that I think our scientific community has really stood up to the challenge and has geared up to the challenge of coming up with a vaccine within less than 1 year, which normally takes anywhere up to 5 to 10 years. So I think that is the biggest achievement of humankind. And if you look into it, even though we see that inequality in distribution, but if you look at, let us say, for an absolute figure for a moment, I think it is the first time in the history of mankind that we have been able to protect so many people with such medical technologies at such a low cost. I think these are some of the positives also that we need to look into it, and also the kind of innovations that have been brought in terms of delivery of healthcare services to inaccessible areas. For example, let us say telemedicine, use of technology to make healthcare accessible to people. So this is the second aspect I think that we need to look into it. And as we all know, when we get into a health shock like pandemic, there's a tremendous, what shall I say, strain on the financial resources of the country, either because they belong to, let's say, a lower category in terms of income, or because of the economic effects of the containment measures that the COVID brings in. So in that case, I think there are a few what shall I say, attempts globally. One is, let us say, the Pandemic Emergency Fund, which is initiated by the World Bank, though it did not reach its optimal level. But then we see these kind of innovations in terms of how do we finance healthcare services to tide over these kinds of external shocks. I think these are some of the great positives that I see as takeaways from this pandemic. Yeah, I'll stop here.
Wonderful. That is very, very insightful, and I'm sure it addresses the query that was raised. Indranil, Sunaina, would you like to add to that? Is there anything else that comes to your mind in terms of the positive outcomes of the pandemic that you would want to add? Indranil?
Okay. So, for me, like the vaccine issue has already been talked about. I think somewhere, if you look at the pre-pandemic situation, bilateral agreements were becoming the dominant kind of trade negotiations. Developing countries after the collapse of WTO were working in silos. Through the TRIPS-Weber proposal, we see developing countries again coming together, putting up an united voice, saying that this is a time where you need to give away the interest of profit and bring in collectivism. That's one of the positives that we see among many negative consequences, I think. And this is probably the way ahead. Developing countries becoming a collective voice of reason and highlighting some structural inequalities and taking challenge of this. Also, I feel this is also a time where some of the UN institutions, like we have realized how important institutions like WHO are. There were efforts to undermine these UN bodies, particularly WHO. If you look at the likes of private philanthropies were becoming more dominant as major forms of response. We have realized that we need to strengthen WHO. Some of the points that Vivek has talked about, data, unless we have a coordinated united institutions like WHO, which represents the interest of entire world, will not be able to mitigate this the future situations like this. And I also, on the vaccine side, some of whatever little access that have been provided to countries like in African continent is also because of the solidarity that WHO has been able to forge across countries. I think so. We need to strengthen the UN system. We are realizing that public system needs to be stronger, and also developing countries are coming together, which is a very positive sign.
Thank you, Indranil. Actually, you answered two questions. There was another question on the chat about the role of WHO. So that also got addressed by your response. So thank you for that. Sunaina?
Yeah, I just want to quickly add, both of my colleagues have covered the most important aspects of this question, but I would say that and I think you did mention that this experience has made us aware and to become better prepared for future crises. And I would say, just like Vivek mentioned about the vaccine development, that it happened in months, then that usually take years. I would say same with education. Though there are still a lot of challenges and inequality in terms of distance learning program, but that would have taken years, of at least 4 or 5 years, and it happened over a period of 4 to 5 months, and that is quite commendable on that part. But that doesn't mean that inequalities can be can be ignored. We need to reach out to every child who deserves education, and I think every child does. So that is one thing. We always have challenges, and COVID-19 definitely was an unexpected. It was the none of the pandemics that we have had in the past, at least from the recorded history. This has been the one that has really affected the livelihoods to this extent. So we know that unexpected can come, and now at least we know that we need to be prepared for this unexpected thing. So that is, I would say, is a positive thing, that at least future crises would be, we have a lesson already and we know how to act, and we will be better prepared to handle every future crisis.
All right, that is absolutely on point. Thank you, Sunaina. What I want to do now is that perhaps come to each one of you with a question which I think you are best suited to respond to. But if I'm wrong, please feel free to disagree and say that you're not suited to answer that. For example, Sunaina, I would want to come to you because there is a question about impact of the pandemic, particularly on mental health of children and youth. So would you like to take that on, please?
Absolutely. I feel that for kids personally, I feel that they are the ones, we as adults, we see that, okay, that's the best age, we were as kids, we do not have to worry about anything. But at the moment, because of this pandemic, I really worry about our kids, because they were always a free source and free soul, and now they have been kind of put in a room or in a house. And for example, talking about India, we have more people in the house than the number of rooms. So we have actually encroached into their personal space. We were never home, and now we are actually using. So if we see that, I don't know how, as time passes and as the kids mature, I don't know what way they will come out, because it's very sad on their part to not have that freedom that we had as kids. So I think that has a bigger mental health impact. I personally feel that kids are the most hit in terms of their freedom being taken, and their spaces have been encroached by adults. So I personally feel that kids are more hit than adults in terms of mental health issues that they will be facing later.
So perhaps there is a need to, talk about mental health in a much more robust way in the context, because, largely, and I can speak for a country like India, mental health as a topic has always been a taboo. One is, always hesitant to seek any kind of help when one's mental health is concerned. So I think, what you brought out is extremely important, that these conversations, not only in the context of an educational institutions, but also in the context of families and communities, have become important conversations. And it is not only about children and youth. In fact, women and men and, adults are facing, and one of the persons on the chat have talked about it, facing burnouts and anxieties,
Yes.
loss of jobs, so all of that plays a role in creating mental anxieties and stress. And perhaps this is a ripe moment to make these conversations more accessible in the context of the pandemic. So thank you, Sunaina.
One point, I would say now at least we are being vocal about mental health issues. Yeah,
true.
Initially, I don't remember we being vocal when we were in as students. We were never vocal. Our issues were never considered to be an issue.
Yeah.
But now we are at least thinking on that right part that even kids, even young youth, everybody has mental health issues, and we need to think about it, and they all matter.
Absolutely. Thank you very much for that. Indranil, I would want to come to you with a question, which again, there is a question about vaccine mistrust. And how does one deal with this kinds of, there are a lot of questions about, are the vaccines effective? I don't think, again, it is up to you that, we are the right panel to be talking about the effectiveness of the vaccines, but there is a vaccine mistrust. And how does one respond? How do health systems respond to that kind of mistrust?
So I don't know, the issue of vaccine mistrust is very common in developing countries, but also in the developed countries. It's not only linked to, it's usually being linked to lack of education, and that is a myth. Some of this mistrust could be unfounded. But then there are issues also. The way state approaches the entire issue of vaccination, particularly in the context of developing countries. So is it a paternalistic state which tries to push something to people? Let's take the example of, say, Covaxin, which is one of the indigenously developed vaccine in the country. When the results of clinical trial were yet to come out and were complete, we started inoculating the Covaxin. You are in a way undermining the importance of scientific evidence and trying to go for something like a vaccine nationalism, driven by the vaccine nationalism, or pushing vaccines. You are trying to you decide on the behalf of people what is good for them and try to impose that on people. How would you have otherwise, how could we have addressed it? We could have discussed with people, take their concerns, views, and opinions in mind, and have a dialogue, a conversation, and address that. In fact, one of the positives of this conversation is, this is where civil society played a major role in this pandemic. In overcoming the vaccine hesitancy, we saw mass movement, civil society playing a very critical role across the developing countries. Why? Because they could connect to people better, understand their issues, and empathize and bring a response. So we need to really change the direction of public policy from a top-down one to a bottom-up understanding, where we understand people's concern and have a conversation and bring out a response, rather than try to force people into something.
Thank you, Indranil. And I would now finally like to come to you, Vivek. The question, and please, if there is any other question that you would like to respond to any of the panelists, I would request you to have a look at the chat. If you think there is something that you would like to respond to that I have missed, please respond. Vivek, and this is something probably later Sunaina and Indranil also might want to add to, is that there is this question that keeps coming up on the chat time and again, is that where do we go from here? What are the steps to be taken? How can we move forward as a society, as a community, after post this pandemic? Where is the world heading towards? What is a possible way forward? So Vivek, your comments on that, please.
Yeah, I think that's a good way to start with from the vaccine hesitancy. One quick comment I have with regard to that is, as Indranil was mentioning, if you look at vaccine hesitancy, many times, most of the time, it is not because of, let us say, lack of awareness or ignorance about the effectiveness of the vaccine. The people who refuse vaccine or who are hesitant about vaccine are well aware about the vaccine as a technology, but there is something else, myths or whatever it is that is preventing them from. So I think in reducing this vaccine hesitancy, as we said earlier, when we talk about global effort or cooperative effort, and no one is safe, until everyone is safe, I think we have to say that in fighting a pandemic, every citizen of every country has a role to play. For example, let's say if in the context of vaccine hesitancy, I need to ask myself, what is the role that I have done to remove vaccine hesitancy? For example, I teach at a university, and I've spoken to several of my students who seem to have such kind of a vaccine hesitancy. I had sessions with them trying to explain, why these hesitancies could be misplaced. So if I'm a teacher in school, I'll talk to children. I'll talk to the parents of the children. I think, in other words, if I may use the concept of an influencer of an Instagram or the present day social media, I think every one of us has a role to play in removing, let us say, the misperceptions that people may have about vaccine hesitancy. So from that perspective, I think if we move forward, and what is the takeaway from this pandemic towards addressing future pandemics, if not making us pandemic proof, one is, as I said, I think the community needs to realize that if you have to address the pandemic, I think we need to first realize that pandemic affects everyone. So every one of us has a role in addressing the pandemic in our own ways. It could be as a teacher, it could be as a doctor, it could be as a policymaker. We have our roles very, very clearly cut out. And number two is that coming back or linking back to the topic I said about global health security, I think we need to find ways as how do we strengthen the multilateral institutions or the UN institutions with a remit to promote global health in terms of empowering them, reforming them wherever necessary, such that they provide the kind of scientific leadership that is required to generate the kind of data that is required to have a global response to a pandemic on one hand. On the other hand, how can we strengthen these institutions to, let us say, call it a global response, a strategic, a coordinated strategy to the pandemic that we might face in the future? I think the greatest stress should be on how do we empower, strengthen, reform where necessary, these multilateral institutions with a clear remit to promote global health. Thanks. I think that's it from my side.
Thank you. I think that sums it up brilliantly, Vivek. Thank you very much. I know there are lots of questions that are coming in, but we do not have much time. But if the panelists would want to respond to a specific question, that I invite you to do that now, or we moved forward and move towards the end of the conversation.
Upasana, I see one question, if I may
yes,
answer that.
please.
Yeah, so basically
Absolutely.
The question says that children in rural India for education are particularly suffering, and what can be done and how it should be done. And I feel that to answer that question, because I have spoken on education, I would like to say that like nutrition, we do something called tracking the status of nutrition outcomes of children and try to see how can they catch up to better outcomes, right? If a child is undernourished, how can the child catch up to a normal level of nourishment? In education also, what we need to figure out right now is that we need to identify the children who needs that targeting, we need to identify the children who are actually lacking behind, and come up with some kind of training programs in school, so that that gap between what the years of education that they have lost through some tutorial programs or something, that we try to bridge that gap in order to mitigate the long-term consequences of the lost years of education. So I feel that first thing is that we need to identify the children so that they can catch up to the expected learning targets. And we also need to keep in one thing very much in mind is that this is a health crisis, but the effect of this health crisis has been on many different aspects. So first thing that a government of any country is right now facing is budget constraints, and we need to make sure that our education budgets are not squeezed further. We need to protect our educational budget so that we know that we can improve the system where the most minority and the most vulnerable population reside, and we can mitigate the consequences for that section of that society. So I feel that we need to come up with some kind of tutorial programs to bridge the gap between those who needs that catch up. And that can only happen if we have a proper sound programs in place and budgets in place.
Thank you, Sunaina. Indranil, I saw you've raised your hand. Do you want to have a question that you want to respond to?
No, so I thought we are running out of time, but I just want to flag one in 10 seconds probably.
Yes, absolutely.
One of the critical concerns in this period of time has been undermining democratic ethos and principles and excess from many country governments and states. If we want to address future pandemics, we need to really rethink about our democracy and strengthen democratic principles of working. So that's one point we have.
Very quickly, those of you who are writing, the session is not ending. We have more to go, so please hold on. I'll be saying that we're running out of time for this part of the conversation, but the session is going to carry on for another 5-6 minutes. So please stay on. Yes, Indranil.
No, I think I'll just close by saying that, or from my part, that we need deepening of our democracy at this period of time. Yeah.
Thank you. Vivek.
I think let me end with a positive note. Being a medical doctor, I cannot help but notice that the pandemic has touched the life of everyone, and the kind of public health hygiene awareness that we see, be it in terms of hand washing, if we have to bring the same kind of awareness during a non-pandemic era, trust me, it would have taken at least a decade, and that has been achieved in a couple of years. I think that's the biggest takeaway of this pandemic for me as a doctor. And the second quick point I would like to make about the positive aspects of, let's say, from this pandemic is that, especially in those countries where the government has a tendency to spend low on healthcare in a very chronic way, for example, India being a good example in context. I hope this pandemic would have sensitized the government the importance of spending adequately on improving access to healthcare. I think these are two major positive takeaways as a doctor from this pandemic for me. Thanks.
Thank you, Vivek, for that positive note to the conversation. And thank you, all of you who have joined in. And I see a lot of questions you're asking. Are we getting a certificate? What is happening? There's so many questions that we could not address. So we feel that this is the right time to all of you who want to have a more deeper and nuanced understanding of the conversations that we've had today, or many such conversations that we can have in the future. I want to talk to you briefly, and I want to invite my colleague, Professor Rajeev Malhotra, to do that, about a new online MA program in public policy, which is being launched, which is currently, the admissions are on. It is being offered by the Jindal School of Government and Public Policy in association with the global online platform Coursera. And it is an interdisciplinary program that analyzes contemporary political, economic, and social issues in a comprehensive manner. The admissions to this MA program is currently on, and I would like to invite my colleague, Professor Rajeev Malhotra, who is a professor with Jindal School of Government and Public Policy and Program Director, Public Policy at JHGP, to briefly talk about this very unique and exciting master's program in public policy that is offered by JHGP. Professor Malhotra.
Thank you, Professor Mahanta. And I'll start by thanking the panelists for an excellent discussion, and also to the large number of participants who were very engaged. Today, for a change, I was following the conversation going on in the chat and the Q&A. I was very happy that to see the quality of engagement in this particular event. I want to mention that this is a part of a series of outreach events that we are holding in order to create awareness about the program that we have launched September 2021. This is a 2-year master's program, which is recognized by the University Grants Commission in India, which is the higher education regulatory body. So which means this is a full-fledged master's degree, which allows you to study further if you want to use that as a step to proceed in that direction. And it is internationally recognized as well. So this is a fully online program and is targeted essentially at the working professionals. But that doesn't mean those who are part of the continuing education stream cannot enroll. In fact, they'll find it a very useful way to acquire degree while they are engaged with other things, while they could also possibly engage with other things, including professional work in the context of the times that we live in. So it's a program which is 2 years, but we can, depending upon the pace of learning that you choose, you can even complete it in 3 years. It is largely done through asynchronous teaching modules. But unlike other online programs, we also have a significant component of live engagement, which are periodically on a weekly basis conducted, so that the faculty comes and in a live discussion resolve doubts and clarifications. The last point I want to say about this program is that the idea behind this program is to not only meet the needs of the times that we live in, but we want to provide a public policy perspective from the global south, which is where the quality of public policy needs the most attention, and where historically, and even in the times that we are living in, time and again, it has come to the fore that if we get policies at the right time and implemented in the right manner, a lot of the problems that societies go through can be tackled very easily. So we have tried creating a program that meets the requirements of the global south while keeping the state of development in this discipline of public policy at a global level very much as a benchmark to create the knowledge and the skill sets for the learners as they seek to upgrade their qualifications professionally. Let me stop here because I think we have run out of time. And I would also like to mention that there will be other events in the series, one very shortly towards the end of this month. So those of you who found this webinar, and I did see a lot of you had very positive feedback on the quality of discussions and the issues that were being discussed, you may want to have a look at that event, which will follow up this one at the end of this month. So over to you, Upasana, and thank you very much for moderating this session so very efficiently and effectively as always.
Thank you. Thank you very much. It has been an absolute pleasure and a privilege. I want to thank all of you, all the distinguished panelists for this evening. Thank you, Rajeev. Thank you, Naveen, who has joined us. Thank you, Anshul, who has made all of this possible. And thank you to all of you who have joined, who are sending all of these beautiful and kind comments. I'm glad and so pleased that you all have found this conversation beneficial and effective, and that there are some learnings that you took away, and you've also seen all the information about the online Masters in Public Policy program. This is a program that many of you may be interested in. All the details about the program were already flagged. You could see the screen. Please write to us if you have any other questions, and we will be more than happy to take on your questions and respond to them. And yeah, thank you once again. And as Professor Rajeev said, this is part of a series of conversation that we have been having. So we look forward to seeing you in the next one. Thank you once again, everyone, and look forward to seeing you all again soon. Thank you very much. Bye-bye. Bye. Bye. Thank you.